Yes, good morning, Dr. Simon.
Morning, how are you?
I'm fine, how are you?
Yes.
Are you the country director of this organization?
Yeah, country director and founder of the Health Home Initiative.
Yes.
Yeah.
Why did you come into existence?
That was around 2011 when we got a recommendation from the Ministry of Health and the Ministry of Internal Affairs, that's
Yes.
NGO Board Secretariat,
Yeah.
gave us the full mandate to operate country.
So, what is your mission? Why are you saying that
we are
HHI should exist?
We are missioned to have a health community for poverty eradication and development. But basically, we first looked at our entry point as looking at health issues. Health issues in Uganda are still wanting. Service deliveries themselves is still a major problem. There are major concerns. There are areas in health that have not been considered important. As Health Home Initiative, we have vast programs. Yes, we have programs concerning safe water and hygiene. That's environmental hygiene and sanitation. We have issues to do with the HIV/AIDS. We have programs to do with cancer, cervical cancer, breast cancer, awareness and screening campaign. This has been completely left out. This one is a campaign we have to look at more sensitively and then to look at it to be done on a larger scale.
So before you continue,
yes, please.
I would like to know, basically we want to link it with the cervical cancer.
Okay.
What is your target population in terms of categories of people that you work with?
As far as cancer, issues are concerned, basically in this particular area where Health Home Initiative is in the campaign of cervical cancer awareness and screening, we are looking at any woman in the reproductive age. Basically, we can scale up to 15 years, up to around 60. Though we look at these who are still functioning up to 49, but the range is basically 15 to 49.
Okay, so I when I was interacting with one of your staff members, he talked to me that he told me that you are running a campaign against cervical cancer, and I heard that you are looking at cancer awareness and screening. Why is it that you came up with that idea? Where do you best to say that actually we need to handle this issue seriously?
There are issues that insinuated us to go into cervical cancer awareness and screening. One of them was the level at which the wards of Mulago Hospital and other referral hospitals were being filled by these cases. Whoever is diagnosed is always in the stage of advanced cancer, and in fact the doctors cannot do much apart from considering chemotherapy and radiotherapy and then palliative care. We were forced to go into a needs assessment in 2011-12, and then we came up with a report.
Where did you carry out that?
We went to different areas, but in this particular case, we targeted the Luka district and then Nakasonga district, where we found out that the literacy level is an impairment level. It's a barrier to service delivery. People are very ignorant. Like in the case of Nakasongola, many are pastoralists. So issues to do with health education is not to their level. They are not taking children for to schools. So it means that by the time a girl reaches 15, he's in the mind of cattle rearing. Can you imagine? Now, in that case, that is the time when we feel a girl has begun or has started indulging herself into sexual issues. Now, look at the background of cervical cancer in itself, in its setting. There is papillomavirus, which is transferred to these women and affects the cervix of a woman, is always transferred by uncircumcised men. Now, in this situation, the papillomavirus is exposed to an innocent girl at 15 years, at 17, at 19, who is now having different physiological body changes happening. So in this case, innocently the girl gets cervical cancer. Now why it comes to cervical? Because there is no earlier detection. it wouldn't have gone to cervical cancer if there was earlier detection. Now, the health home cervical cancer awareness and screening project is aimed at creating awareness in these communities where we are targeting. We really, in our report, we found out that there is a complete need. The government has done in the management to those who are referred. But we are saying the management should not begin at referral. It should begin at the grassroots. So we are saying the campaign should go into screening, into awareness, and then we screen. Lucky enough, we are touched. We're a medical team of Health Home has gynecologists. We have Dr. Kadag Henry. We have Dr. Waiswa Stephen. We have Dr. Nakai. All these are gynecologists who have volunteered time to time. I remember we had a program in Chiboga for awareness campaign and screening. We screened about 1,000 women who are turned up. In that week, we had a session. So the awareness campaign is aimed at creating and harmonizing the treatment trend, changing it from referral to the grassroots. That's why in our campaign, the village health team is a very important component.
All right. Now, we are saying, I wanted you to give a word to the world, since I know the mobilizing resources is a tug of war in these programs. So, what are you appealing to the society or to the world?
In that case, I really appeal to the world. First, to the ministry. To completely facilitate and join our campaign. The world should join us in a campaign of awareness and screening. Because if we have better resources mobilized, then we can reach this common. Because a medical team is what could be the expensive. But we have now these people who matter in the screening session, in the awareness. Those who can speak and people understand. So they can only join our campaign by putting in that penny, contributed $1 towards the campaign. So we are requesting the whole world to join the Health Home Cervical Cancer Awareness and Screening campaign.
Thank you very much.
You're welcome.
We'll meet next time.
Thank you. Thank you for coming to our offices.
Thank you.